Hello beloveds, welcome back to my channel. My name is Nikita, a psychologist and a psychotherapist. The therapy I am trained in and certified is called cognitive therapy. So it started with cognitive behavioral therapy, which was introduced by Dr. Aaron Beck, and then I got trained and certified in Team CBT, which is an advanced model of cognitive behavioral therapy. Team CBT model was introduced by Dr. David Burns. I am starting this new series called Be Your Own Therapist. My intention is to help you, to guide you to become your own therapist. In the coming sessions, I will be discussing with you the psychological principles, or I should say, few principles of cognitive therapy, so that you have better understanding about your own psychology. You have the correct understanding behind the connection or the relationship between your thoughts, feelings, and behaviors. And with every session, you become more and more equipped in handling yourself, in taking responsibility of your own thoughts and feelings and actions, and becoming more equipped and resourceful in terms of understanding your own psychology. Not to treat other people unless you are a trained and certified one, but this is mainly to guide yourself, to psychoeducate yourself, and see then what works best for you. But yeah, in case if you are going through something, or if you know someone who is going through or who is suffering mentally, meaning means having a low mental health or is suffering some way, then please take a professional help. Don't feel hesitant to take a professional help, because this is your mental health is equally important just like your physical health. So your mental health has to do with your how you are feeling psychologically and what you are going through emotionally. So just like your physical health, I think it's I think you will be able to relate this. Like once our phone recharge gets over or phone battery gets low, what do we do next? Or we put the phone to charge itself, or we renew our internet package or our Wi-Fi package, right? Or if suppose at any time any of our social media apps are not working, we do something to make sure that it just starts working. Just like that, our mental health also needs to be recharged, also needs to be renewed, meaning we need to be renewed, recharged, and rejuvenate ourselves. So in that case, please seek professional help. Coming back to my session, so the first one in our series Be Your Own Therapist is about cognitive therapy. So introduction to cognitive therapy. What is cognitive therapy? A great philosopher Epictetus said, people are disturbed not by things but by the views they take of them. I repeat, people are not disturbed by things, meaning not by external events, but by the views, meaning the thoughts they think about that situation, the mental attitudes and beliefs and perceptions they hold about that situation. That makes them feel the way they feel. So, what is cognition? A cognition is a thought or perception about any situation. You feel the way you feel is because of the thoughts you are thinking at any moment. So your cognitions are your thoughts, your perceptions, your mental attitudes, your interpretation about the things you are thinking at any moment, including this very moment. So right now while watching this video, whatever you are feeling, that's because of the thoughts you are thinking. Now your feelings could be more enthusiastic, more on the happier side, or it could be negative as well. It could be irritating also. But that is coming from the thoughts you are thinking. Let's say at any point of time, at any moment in a day, you feel a little bit of discomfort, or you feel negative, or you feel positive, or you feel really good or sad or low. That is coming from the thoughts you are thinking. So just like while scrolling Instagram, the post, the stories we scroll, right, that comes how it just comes automatically. Our thoughts also scroll into our minds automatically, but that has a huge impact on the way we feel. Is this clear? So your cognitions are what? The thoughts, the perceptions, and the interpretation, meaning the meaning you give to the situation, that determines how you feel, not by external events. So this is the essence of cognitive therapy. Let me give you an example. Suppose anyone reads any self-help book because the person is feeling very low and depressed. So what will be the thoughts like? Let's say, I'm such a loser. What is wrong with me? I'm sure there is some problem in me. I am defective. These thoughts are creating the feelings of sadness or depression. Let's say another person thinks, oh, maybe this book is going to help me, but it will help me if I actually apply the learnings, the teachings followed by the exercises. Let me just give it a try. What will be the feelings of this person? Enthusiastic, excited to read that book. Let's say another person sits with the same book and the thoughts goes like, oh, this book is so boring. Another self-help theory which has just no use. I mean, everything is going to be same. My problems are real. What change is it going to bring? Then the feelings goes again low, sad, down, or maybe a bit frustrating as well. So you saw the situation was same for all these three readers, but their reactions were different. Why? It's because of the thoughts that they were thinking. Now this same example, now you can think of your own example and then check. So that example, let's hear reading a self-help book was a situation, or watching this video, you may think, you may have a thoughts like, here she goes again with another long session. My problems are real. She doesn't understand anything. No one understands. Then the feelings goes low, a bit worried, depressed. Or while watching any other video, a person thinks, okay, let me sit with the book. I'm going to allot this 10 to 15 minutes to this. Let me see what I can learn, and most importantly, let me just start implementing it. And let's see what it brings. What will be the feelings? Excited, enthusiastic, right? So the situation is same, but our reactions are different. Why? Our feelings are different. Why? It's because of the thoughts we are thinking. It has nothing to do with the external event. This video, any other video, or any book, or anything. People, event, circumstance, situation, anything. We are not disturbed by external events. Now, external events are not in our control. So, if you try to control it, at some point of time, you may run dysfunctional, because you won't be able to control everything in your life. But what you can control, what you can change, what you can manage is your own thoughts, and that's the only thing that is in your control. So you have to take responsibility of the meaning, the interpretations, the mental attitudes and belief systems you hold about any experience, event or situation that occurs in your life. So that's the essence, and this is the heart of the cognitive therapy, that your feelings result from the message you give to yourself. Now here is the secret. If you want to feel good, if you want to feel better, what do you have to do? You have to change your thoughts. You have to become aware of your thoughts. You have to write it down. You have to ask yourself, so okay, something happened, you felt some sensation here in your body, you didn't feel it correct, there was something like discomfort or unpleasant. Ask yourself, what am I thinking right now? What just went through my mind? And start noting the thoughts. So that's the secret. If you want to change the way you feel, you have to change your thoughts. This is the essence of cognitive therapy. I repeat, your feelings are coming by the messages you are giving to yourself. Our cognitions are our thoughts and perceptions to any given experience or situation, and that is determining our feelings. So it's not the external events. We are not disturbed by external events because they are not in control most of the time, but whatever we are feeling, that is coming from the thoughts we are thinking. So if you want to change the way you feel, you have to change your thoughts. In fact, your thoughts has much more to do with your feelings than the actual real situation. Let's look at the research about the effectiveness of this cognitive therapy. So they divided the patients into two groups. Now these patients were suffering through moderate to severe level of depression. The first group of, and the participants were randomly assigned to both of these groups. In the first group, the patients were treated with cognitive therapy only, and in the second group, the patients were treated with drug therapy only, meaning with medications. And this procedure continued for 12 weeks, and later on they checked using psychological testing as well how much the depression level has reduced or what has happened. And what they found, that the patients responded better with cognitive therapy alone than with medication or drug therapy alone. So in the first group, out of 19 patients, 15 patients recovered using only or were treated using only cognitive therapy. So they were treated only by cognitive therapy. Whereas in the second group, the recovery out of 25 was only 5 that got better. That means that the cognitive therapy is really effective. Now in cases of severe or clinical depression, we do recommend medication plus therapy. But my point here is to explain you what the research says about the effectiveness of cognitive therapy, that it is much more effective than medications or drug therapy, or should say equally effective, and gives more lasting effective results. So this is the effectiveness. So the first thing, that these patients improved rapidly than the second group, and even the suicidal statements, the suicidal thoughts were also reported less. So this is my introduction to cognitive therapy, that I would like to conclude saying again that your thoughts, your perceptions, the interpretation, the meaning you give to the situation, that is making you feel whatever you are feeling at any moment. So change your feelings by changing your thoughts. See you in the next session. Thank you.